Just 12 days until Christmas, and pretty soon, all your mothers, brothers, sisters, grandparents, aunts, uncles, and cousins twice removed will make their way into town to celebrate. And they'll want to know everything you've been doing and act like they haven't seen you in over 20 years. But doctors say catching up with a loved one you don't see on a day-to-day basis could be the perfect opportunity to spot dementia. Over 5.5 million Americans suffer from the progressive neurological disorder that affects the brain. And as persons' age increase, so does the risk of developing Alzheimer's and dementia. And joining us to talk about it tonight, our medical expert, Dr. Danish Ali, with some signs and symptoms you can be on the lookout for this holiday season when grandma or grandpa sitting across from you at the table. Let's establish first, what is dementia?
Sure. Dementia is a constellation of symptoms. It's not an actual disease itself. Alzheimer's, Parkinson's, frontotemporal dementia, those are forms of actual dementia itself. And again, the dementia is symptoms that you have. Symptoms being memory loss, forgetting where you parked, forgetting how to do mathematical equations, or how to pay bills. You know, short-term memory loss is really one of the common things that we really see with folks with dementia. And again, it's so important to get evaluated for folks that have signs of dementia because there's different forms of it and they get treated differently. The progression of how much the severity of that disease is changes with the disease itself.
Now, we have also some signs of dementia that we can go over for those who are concerned about their family member or loved one, doctor.
Sure. Yeah, memory loss being one of them. That's actually the most common short-term memory loss, as I said earlier. You forget where you place things. You forget a person that you recently met. You have difficulty in completing some of those tasks that you have on a daily basis. It's folks that come into your hospital setting and they tell you that they're having mood swings, personality changes. They're very irritable. They have points where they just kind of, it's like a little switch that they have. Sometimes they're happy, sometimes they're sad. And one of the things that I want to point out to your viewers is that depression is very common in folks that have dementia, and it's very important if you see signs of depression to get evaluated for that, because it may be early signs of dementia itself.
And what we would have to do as family members is pay attention to them, not just saying, oh, grandmother forgot something or grandpa forgot something, and just blow it off.
That's correct.
We're the first line of defense, I would think, if we're family members and we're around them on a day-to-day basis.
That's correct. And a lot of patients have difficulty in admitting to that fact that they have early forms of Alzheimer's or dementia. They have trouble in recognizing some of the symptoms. And so it's very important for folks that see their loved ones on an annual basis to, if they see that sort of a progression, to talk to them about that and say, hey, is there something that, you know, maybe they can help out with, or maybe they can get in touch with somebody that can help as well, a medical professional.
Where do we start? Do we start first with the family doctor, or do we go to a neurologist? Do we go to a specialist if we think, as family members, something is going wrong?
Yeah. I think the place to start is actually with the family doctors. I think they're the ones that are well versed at knowing the patient itself. They've got a patient-doctor relationship that they've established, and so the first place to start is with a family doctor, and then if those folks believe that it's necessary to get a specialist on board, then they can get a neurologist, neurosurgeon, or either a PM&R doctor as well.
And in the last 30 seconds, Dr. Ali, tell us the difference between dementia and Alzheimer's.
Sure. So again, like I said, dementia is a form of symptoms that you have. So again, symptoms that we talked about. Alzheimer's is a form of dementia. There's other types as well. Alzheimer's is the most common type of dementia that folks get, but again, frontotemporal dementia, normal pressure, hydrocephalus, Huntington's disease, these are all different diseases and disorders that present with forms of dementia itself. So again, it's different, two different classifications, but again, the Alzheimer's falls into the dementia as well.
So the key is pay attention to your family member. Dr. Danish Ali, thank you for coming on The Factor Uncensored.